What is syphilis? Syphilis is an STI spread through vaginal, anal, or oral sex with an infected person. It's caused by bacteria and can be treated with antibiotics. If left untreated, it can cause serious health issues like blindness and damage to the brain, heart, eyes, and nervous system. How common is syphilis? According to the CDC, around 134,000 cases of syphilis were reported in 2020. It's more common in men, especially those who have sex with men. What are the symptoms of syphilis? Syphilis symptoms vary depending on the stage of the infection. You're most contagious in the early stages when sores appear on your genitals. In the second stage, you might get a rash and feel flu-like symptoms. After that, symptoms can disappear, but the infection remains. Only treatment with medication can cure syphilis and prevent it from getting worse. What are the causes of syphilis? Syphilis is caused by bacteria called Treponema palladium. It spreads through sex, including vaginal, anal, or oral. The bacteria can enter your body through openings like your mouth or genitals or through cuts on your skin. It then spreads through your body, possibly causing damage to organs over time. How does syphilis spread? Syphilis is contagious, especially when you have sores or a rash. It spreads through sexual contact, even without penetration or ejaculation. If any part of your body touches syphilis sore or a rash, you can get infected. If you have syphilis and have sex, you can pass it to your partner. Pregnant people with syphilis can pass it to their baby. But you can't get syphilis from things like toilet seats or doorknobs because the bacteria can't survive on objects. Can you get syphilis from kissing? While it's not common to get syphilis from kissing, if you touch a syphilis sore directly, you can get infected. So if you kiss someone with a sore, you're at risk. You can also get syphilis if you have any cuts or scrapes on your skin that touch the sore. That's why it's important to get treated if you think you might have syphilis or if you've been around someone who does. Can syphilis cause problems during pregnancy? If you have syphilis and you don't get treated, you can give it to your baby. Up to 40% of babies born to untreated syphilis cases can die from the infection. Usually the infection passes from the parent to the baby during pregnancy. But it can also happen during childbirth if the baby touches a syphilis sore. When a baby is born with syphilis, it's called congenital syphilis. Syphilis during pregnancy can also cause. If a pregnant person has untreated syphilis, it can cause serious problems for the baby, like being born too early, being born too small, having issues with the umbilical cord, being stillborn, even dying within the first month after birth. That's why it's really important for pregnant people to go to their doctor appointments and get tested for STIs. Treatment before 26 weeks of pregnancy gives the best chance for a healthy outcome. What are the health complications of syphilis? If syphilis isn't treated and it gets really bad, it can cause serious problems that could even be life-threatening. The longer you have syphilis without treatment, the worse it can get. That's why it's super important to get treated as soon as possible. Untreated syphilis can lead to things like blindness, paralysis, and issues with your heart, brain, spine, and other parts of your body. How is syphilis diagnosed? When you see your doctor, they'll ask you about your sex life and if you use protection. It's important to be honest so they can figure out if you're at risk for STIs and suggest tests if needed. To check for syphilis, your doctor will look at your body and take a little blood to test for the infection. Sometimes they might take a tiny bit of fluid from a sore, if you have one. The only way to know for sure if you have syphilis is to see your doctor and get tested in a lab. How is syphilis treated? When you have syphilis, your doctor will give you antibiotics. These are special medicines that fight bacterial infections. The most common antibiotic used for syphilis is called penicillin. How much medicine you need and for how long depends on how bad your syphilis is. Even if your symptoms disappear, it's really important to finish all your antibiotics. You should also tell anyone you've had sex with in the last 2 years so they can get tested too. After treatment, your doctor will check your blood to make sure the syphilis is gone. Remember, you can still get syphilis again, so it's smart to practice safe sex and get tested regularly if you're at risk. Is syphilis 100% curable? If you have syphilis, your doctor can give you antibiotics to treat it. Antibiotics can cure the infection, but unfortunately, they can't fix any damage already done to your organs by syphilis. How can I reduce my risk of getting syphilis? The best way to avoid getting syphilis and other STIs is to not have sex. If you do have sex, using a condom or dental dam every time can help lower your chances of getting infected. Make sure you know about your partner's sexual history and if they've been tested for STIs. If your partner has syphilis, they can pass it to you, so it's important for them to get treated too.